The EU Commission is calling for tighter controls on exports of the Oxford-AstraZeneca vaccine produced inside the bloc. Those calls come amid growing frustration at the vaccine maker's decision to cut deliveries to EU members. The company is blaming supply chain problems, but Brussels has accused it of failing to keep contractual promises. All 27 EU countries are struggling with slow vaccine rollouts.
This may sting a little, but it's over in the blink of an eye. Getting vaccinated may be a speedy affair, but vaccine rollouts across the EU have proved painstakingly slow. The bloc's executive is pointing the finger at the pharmaceutical industry.
The European Union wants the ordered and pre-financed doses to be delivered as soon as possible. And we want our contract to be fully fulfilled.
That's a message for vaccine developer AstraZeneca. The UK-based firm recently announced it would be unable to fulfill its EU orders in the agreed timeframe. AstraZeneca says that's down to supply problems in the EU, possibly here at the Belgium headquarters of Novacep, a company that works with AstraZeneca to deliver key vaccine components. The AstraZeneca jab is due to get the green light from EU regulators in the coming days. So last-minute news of a 60% cut in deliveries came as a nasty shock to lawmakers here in Brussels. Governments have been rolling out the red carpet for the pharmaceutical company. We do not have the vaccine thanks to them, but thanks to public funding. The public paid for the production capacity. The deal to secure supplies of the AstraZeneca vaccine was an EU first that brought a big smile to the health commissioner's face back in August 2020. The bloc purchased 300 million doses with the option to add 100 million more. In other words, the European Union is AstraZeneca's biggest client. It paid hundreds of millions of euros up front in order to ensure smooth production and supply. But with promises unfulfilled, the bloc is not a happy customer. The big question is now, where have all those pre-produced vaccine doses gone? They may have been sold to the highest bidder elsewhere. That's why physician and politician Peter Liese welcomes news that producers may soon be obliged to notify the EU before they export any COVID-19 vaccines outside the bloc.
We want to cooperate, but if others don't play fair, the European Commission has to show the weapons. And the first step is to register. The second step is an export ban.
Pharma giant Pfizer has also been in the firing line recently. It too announced delays earlier this month, citing production issues at its main site here in Belgium. Producers say they're moving as fast as they can, but in the race between vaccine and virus, every delay could cost lives.
That report from DW's Georg Mattes, and he joins us now from Brussels for more. Hi, Georg. Help us understand this. Is the EU really implying here that AstraZeneca has been selling the EU's doses of this vaccine to someone else?
Clearly, Sumi, that is a concern here. And if you look at the sheer numbers of vaccination, you can see that the UK has vaccinated, for instance, 10 out of 100 residents, whereas the EU is yet to reach 2 out of 100 residents, 2 doses per 100 residents. And so the concern clearly is, has a vaccine has the prepaid and pre-funded vaccine that the EU has bought in the contract already been given to UK residents? Of course, in the UK, the approval has been given earlier, an emergency approval, and only a first vaccine dose is given. So we yet have to see when the second dose will be given. So the UK is ahead, but a concern clearly is the UK ahead because they had their hands on more vaccine that were meant to be for the EU?
Georg, what about this question of the export ban that you mentioned in your report, that vaccine producers might have to notify the European Union before exporting? How big of a difference could that make?
Well, so far, the UK, for instance, is not affected by the supply cut announced by AstraZeneca. And AstraZeneca, of course, produces not only in the UK, but also produces its vaccine in the EU. And now, with this transparency mechanism that the EU is suggesting, is a clear signal to the industry that they're now ready to play hardball. Because, of course, what the EU could do is say, we will look exactly how much vaccine is being delivered into the UK or so elsewhere into the world. The US, for instance, in case of AstraZeneca, hasn't even started approval, so nothing has been going there. But the EU can clearly monitor now where things are going, and in case they have the feeling that too much is going there, that should be going to Europe, they could even introduce a ban.
Meanwhile, there have been reports in German media that the AstraZeneca vaccine is essentially ineffective for people over the age of 65, and that really has stirred controversy. Can you tell us more about those claims?
Clearly, Zumi, I'm not a medical expert, so I can't exactly comment on that issue. What I can tell you is that AstraZeneca has disputed these rumors, as they say. And what I also can tell you is that in Europe, the medical agency is now looking at tons of material from AstraZeneca. And what they will do is they will not give an emergency approval, but the normal approval, a fast approval. And they will give a recommendation per each age group. So we'll have to wait until the end of the week, most likely. That is when the approval from the European Medical Agency is expected.
DW's Georg Mattes reporting from Brussels. Thank you so much. Well, Germany's health minister declined to comment on those reports about AstraZeneca's efficacy this morning, but he has backed the EU calls for more export controls on vaccines made in the bloc. He told DW's chief political editor, Michael Küffner, it's about fairness.
With me now is Germany's health minister, Jens Spahn. Mr. Spahn, so will you now ask the European Union to implement a registry for the export of vaccine outside the European Union?
It would be a good idea if companies had to obtain a license to export vaccines so that we can monitor which vaccine leaves the European Union after having been produced or bottled in Europe. Licensing does not mean a prohibition of exports, but that they at least need to be registered and approved. And that will happen in many cases that it is approved. We do not want to keep everything to ourselves, but I want things to be fair so that when there are supply problems, the impact is felt by everyone and not just by the European Union. This is an area where we are somewhat uncertain at the moment whether the consequences of problems in production are evenly distributed.
The United States is following an America First policy, ensuring that each US citizen gets vaccinated before those exports take place. Does the EU now want to follow an EU First strategy?
No, I'm talking about a fair share, that we obtain a fair share of the material that we financed in advance. After all, in almost all contracts that the European Union negotiated, we invested hundreds of millions of euros in advance so that production capacities could be established. So it is not a matter of being first, it is a matter of being fair. That is the point here. But of course, we as Europe, as the European Union, as the German federal government, always stressed that we are also thinking about the supply of vaccines to the rest of the world. In the end, we are developing vaccines here in Europe, in Germany, for the whole world. It is our goal that others too can profit as soon as possible. But one thing remains true. I can't tell German and EU citizens that vaccines produced in Europe are available all over the world, but not in Europe.
Minister Spahn, thank you very much for the interview.
Okay, let's get some more perspective on this story now. We have Rob Watts from DW Business with us. Hi, Rob.
Hi.
We heard Jens Spahn, the German health minister there, being pretty even-handed on this question, but we also have heard voices of real frustration and anger from the European Union. Is that warranted?
Without doubt, they are angry, because what we're talking about here is a contract. The EU has, as Jens Spahn was saying, invested hundreds of millions in this particular vaccine. It got in good and early back in August. It was the first vaccine that the EU placed an order for. It gave its money over, saying, look, AstraZeneca, you can take some risks here in developing this vaccine. And then when you've got it ready, you can, get it to us as soon as we can approve it. Now, if you believe what AstraZeneca is apparently telling the EU, which is that they've had problems getting the materials for their vaccine and that they've had problems with the mechanics at one of their plants, then that's to some extent not under their control. But if you believe what some EU officials clearly do believe, and that AstraZeneca is instead choosing to send its vaccines abroad to countries that are maybe willing to pay a bit more, then yes, the EU, I suppose, has a justification for being angry. The Italians are particularly angry because they're going to get this quarter less than half of the 8 million vaccines that they were expecting. And they've gone so far as to say that they're going to launch legal action against AstraZeneca. We may well see the same from the EU.
This is all putting AstraZeneca under a lot of pressure, isn't it?
Yeah, and it's not the only pressure that they're under. So we obviously, as you've already discussed, have the questions over its efficacy among the over 65s, but there are also discussions going on about the prices that AstraZeneca is charging to different countries. For example, it doesn't just produce them in Europe, its vaccines, it produces them also in India, and South Africa has just placed an order for 1.5 million doses from its Indian factory, and it's been charged $5.25 for that. Now, the EU was charged just over $2 per dose. So South Africa is being charged more than double what the EU is being charged. So there are clearly questions to be answered over why wealthier nations appear to be paying less for this vaccine than less wealthy nations. So there are various battles being fought by AstraZeneca at the moment.
Very interesting. Rob Watts from DW Business, thank you so much.
Thank you.